Here I'm checking out an X-ray of the neck, the cervical spine. So some of the landmarks we can see here, this is the skull, here is the jaw, and here are the teeth, and here is the cervical spine. These are the vertebrae that form our neck. Here we have the first vertebra, the atlas, the second, which is called the axis, and the third, fourth, fifth, sixth and seventh cervical vertebrae. We check to see how the spine is aligned. In this case we have a very straight neck, which can happen as people get older and often happens if they have neck spasm. This person has lost her normal cervical lordosis. The curve would normally come around like this. In between each vertebra we have disc spaces which we check out, and in this case you can see this space is very narrow, and this is between C1, 2, 3, 4 and C5. Also between C5 and 6 we have a narrow space here, and we do look as well at the back here where, as we can see, there are little bones sticking out which we call osteophytes, and that forms together a degree of arthritis of the neck. Again, we've got some bony spurs at the front here. This usually indicates some degeneration of the spine. We can't actually see the discs in an X-ray, so sometimes when we see an X-ray like this we might assume that we need to see an MRI scan, and that again would depend on the person's symptoms as well. On this one we can see the spine from front to back, and the last one was a lateral view from the side, but this is a front to back view. Here we can clearly see that the skull is not straight, which would tell us that the first vertebra was also rather out of line. I can just about see a little bone called the dens in here, and I can see a bigger space on the right than the left, and together with this we would definitely check the first vertebra to see if it was out of line. In this patient she has a scoliosis, so we can see that the spine itself is not straight, and we can also see in these little spaces here more signs of arthritis and discs which are degenerated. For comparison with the previous X-ray, here we have a cervical spine which has got a good curve. This is an X-ray of a younger person with no neck pain, and it was taken after a whiplash accident. But in fact it shows that his cervical spine is in good shape. So we have this nice C-shaped curve, and these disc spaces, as you can see, are all nice and large, showing that there's no disc degeneration. We have no arthritis at the back, no little osteophytes sticking out, and the alignment between the vertebra is all very good on this side view.